Okay, so to begin, to get started, I really wanted to give you a brief recap of the Atlas of MS for those of you who are perhaps less familiar with it. So the Atlas of MS is a global compendium of data. We cover the epidemiology of MS. So that's things like the number of people with MS, the number of newly diagnosed each year, how this varies maybe by adults and children, males and females, and of course the different types of MS. We also include questions about diagnosis of MS and the clinical management of MS. That's things like the treatments and number of healthcare professionals. So far, we've published 3 editions. The first in 2008 in partnership with the World Health Organization. The second in 2013, and our 3rd edition was published in 2020 and 2021. So as you can see, in the past, there's been 5 to 7 years between editions. We are working this year on making the Atlas more flexible so that we can update key data on an annual basis, just to ensure that the Atlas remains relevant and to encourage people like you in our audience today and researchers to really analyse the data and find new insight. We will also generate new data and evidence more regularly via topical surveys. And the first of these is around disease-modifying therapies. I am collecting a list of questions, though, to ask in future surveys. So please do reach out to me to let me know if there's any questions or topics that you'd like to see in future atlases. And let me know how you'd use that data, because that helps us know what kind of information you use and what kind of things you will be doing with it. So the Atlas of MS is collated via crowdsourced data collection methods, and that allows us to be as comprehensive as possible because we go beyond just the published data. And we also attempt to reach every country in the world. And within countries, we ask experts such as neurologists, researchers, epidemiologists, and MS organisations to collaborate together to ensure that the data provided to the Atlas is accurate, it's recent, and provides a comprehensive and complete picture of the whole country. And I want to say a huge thank you to all of you in this audience today, and those of you watching the recording for your dedication and support for the Atlas. It's a mammoth data collection exercise. And I really appreciate your help in providing the data for your country, answering my clarifying questions, of which have been many, and really ensuring that the Atlas is a powerful tool for advocacy. So to ensure that the data in the Atlas is as useful and accessible as possible, we've published the 3rd edition data in a variety of formats on the Atlas of MS website, as shown here. So there's 2 global written reports, and they're written in a simple English format and also translated into other languages, into Spanish and Arabic. There's also country fact sheets that show key statistics, and that's kind of quite a useful top line summary for maybe decision makers. It's kind of designed in an infographic style. We have scientific papers that look at disease-modifying therapies and the epidemiology of MS. We've also got social media graphics and videos which show the key messages and feature people with MS. And finally, we've got the complete data set, which is downloadable to allow own analysis. And as I said, the information is available in English and Arabic and Spanish, and we've also provided translation templates and design files should there be any other languages that you wish to translate it into. Okay, so I'm often asked about what the benefits are for the Atlas compared to other data tools out there. And I think one of the key things is it is a trusted and credible source of data. It's available open sourced, which researchers and you on this call can review and conduct your own analysis, maybe find new insight. And obviously there's the scientific papers that have been published that can be referenced as sources of evidence in other work. Now, a lot of the data that we collect in the Atlas is available, of course, within countries, but it's often reported across various different sources. And the Atlas brings that data together all in one place, which clearly has some advantages. The Atlas also allows for comparison to other countries in the region or to the World Bank income band of that country. And that can be very powerful to show what the current situation is, but perhaps what might be possible by learning from other countries. We know that numbers matter, and this type of data can be used to tell impactful stories to influence change when talking to policymakers or health officials. And as it's a global tool, it allows us as a movement to discuss and learn from each other, as we're very much doing today, and provide examples of different advocacy efforts to inspire. And finally, it's important that it shines a spotlight on where there are gaps in the data, both nationally and globally, so that we can persuade decision makers to address this, as good data clearly is the cornerstone to allow healthcare planners to meet the needs of people affected by MS. And I've definitely heard from people that showing decision makers how your country lacks data compared to others can be a powerful motivator to kind of galvanize action to address this. So that's all from me from the moment. I'm now going to hand you over to Abdul, who will talk more about how you can use data from the Atlas in advocacy. So over to you, Abdul.
Thank you, Rachel. Hi again, everyone. I'm just here going to give you an overview of kind of steps and process that an MS society could take to initiate and implement an advocacy project, and how could we make use of Atlas to kind of underpin and support our advocacy work and efforts. As you can see, it's very much about we start the project with identifying the issue, what problem we're trying to solve here, and within that we also start to do a bit of more analysis and research to get a more in-depth understanding of the issue, barriers around this issue. That could be access to treatment, it could be access to diagnosis, it could be something else. So these two processes are very tied together because they kind of feed into one another. And once we kind of gathered all the information we need, that's where we start to put everything, put a clear aim and objectives what we work towards. And then next step will be very much, which is number 4, is identifying who are we trying to target, and do we have a good understanding of the decision makers, what the source of influence within those decision makers, and all of this information kind of also could help to identify who will be our allies. And we've heard a lot from MS societies that they often go and create a coalition or work with other chronic diseases or disability organization, because there is a common interest that they can come together and work on a piece of advocacy work. And obviously it's so important to look into reality resources we have. And when we say resources, we not only mean financial resources, but time and capacity of your organization and the team to be able to take up the work. All of this really together goes into a plan, an action plan that you kind of use to implement your activities and start to monitor, evaluate, and look into that. I didn't want to go into much deeper into every single parts or steps of those, because if I'm just conscious of time, but I would welcome any question or a follow-up from you afterwards if you'd like to know more how you go into what the details of each of those steps. I'll be very much welcome to follow up with me after the webinar, and we can share with you some resources. Next slide, please. Right, I've extracted these 3 steps of the developing and implementing an advocacy web, because these where the Atlas or a toolkit like Atlas can be very useful in order for us as MS societies to identify what the problem we have, what the challenge we have. We obviously need to do a bit of research into them to just validate whether they actually a priority, to also to be able to know whether these challenges are actually real, and also basically gather data and evidence to use that when you go for the implementation stage, because without this evidence and information, I think our case for advocacy won't be as strong as it would be when you have evidence that you gathered. That's always a question that decision makers will ask is, what's your evidence? Do you have data? And here Atlas could come in and play very well, and being able to be a very useful tool to identify what DMTs available in the country, what challenges related to unavailable DMTs, the level of access to diagnosis, MRI machine, neurologists, so many aspects within Atlas that your society could look into and try to pull the information out and use this as evidence to inform your planning, but also to use to be able to communicate with decision makers as it's a reliable tool. So it's kind of will be taken as an evidence. And obviously you could even start to look into comparative. So to see what's the situation in your country, what is it like in other neighbor countries or other countries that have a similar socioeconomic situation. And that's where you start to kind of bring that into your advocacy work and trying to show that, you know, look at that country next door. They have much better access to MRI machine or diagnosis, and that kind of could be used as an argument. And again, it's all backed up by the evidence that you can gather and bring from the Atlas. And obviously, when you reach to the implementation, monitoring, and evaluation stage, and again, that's where you can start to identify gaps in your data. And I would say when we do advocacy, you could do advocacy to influence improving services or rights of people with MS to access certain support, but you could also run an advocacy to influence and persuade decision makers or certain entities to actually themselves try to bridge the gap around the missing data, to develop a comprehensive MS registry or whatever data you're missing and you need. So you don't necessarily need to do it yourself, but you can advocate for it and persuade and influence those who has the resources to do it. So you could approach it from obviously 2 different perspectives. So that was in a nutshell what the different steps of developing and running an advocacy project, and how Atlas could be a useful tool to inform your evidence and data collection in a different stage of your project cycle.